everybody. Thank you all for joining us today for our 6th COVID-19 virtual town hall. We are once again co-hosting with our friends from the European Academy of Dermatology and Venereology, the EADV. So before we begin, my name is Nicole Sudiaco and I'm the Member Services Manager at GlobalSkin. I'll be moderating today's COVID-19 virtual town hall, the psychosocial impacts of COVID-19 on patients with chronic skin conditions with Dr. Patrick Kemperman.
Thank you, Nicole. Welcome, everyone. Thank you so much for being here today. And thank you to the EADV for co-hosting this session with us. It's really wonderful. So my job is to introduce Dr. Bibi Monfrance from the EADV, who will then introduce Dr. Kemperman. So Bibi works at the Erasmus Medical Center in Rotterdam. She's the principal educator of trainees who do their 5-year training in dermatology. She's been active with the EADV since 2012, and she was first involved by co-organizing the yearly Congress in Amsterdam in 2014, and then as a board member. She's currently the chair of the Patient Association Working Group, the EADV School, and the EADV Advocacy Group.
So thank you so much, Jennifer. So I'm really happy working for the EADV. Currently, I'm really happy as a chair of the patient working group, working together with EADPO, and it is a big pleasure for me to be here tonight or today with you, and also introducing my dear colleague Patrick Kemperman. So the EADV has more than 7,000 members at this moment. We have organized many congresses, and this year we will be having the first virtual congress. So everybody in the staff is very excited, and we are all looking forward to this first virtual congress. Of course, we miss really intensely of having real human contact with all our colleagues and all the participants, and with you, of course. I'm so unhappy we will not be meeting in person this year. Anyway, we do the best we can. And what is our vision is depicted on this slide. So we would like to further the knowledge of health professionals and advocates in the field of dermatology and venereology, and you are one of them. And so we are dedicated to patient care, but also to education and providing this platform to connect people with each other. So next slide, please. So what do we do? These are our main focuses of the EADV, and one of them it is enlisted here. So it's very important for the EADV is to act as an advocate for patients, and by empowering you as patient leaders, we also like to help our patients being better able to live with their skin disease, or to help them cure their disease. So for today, I would like to introduce Patrick Kemperman to you. We are colleagues and always enjoy seeing each other. He is a dermatologist with a focus on psychodermatology, and he's also currently the chair of the Psychodermatology Association in the Netherlands. So Patrick, the floor is yours.
Thank you so much, Bibi. Hello, everyone. I'm very pleased to be with you and to share my experience with you. Today we will discuss the psychosocial impacts of COVID on patients with chronic skin conditions. What will we be doing today? First, we will learn from the past what happened with other infections with skin patients. What can we learn from it, and how can we act on here? There has been some studies about the psychological impact on COVID on mental health in the general population, so not specific for the skin population. There was related to the SARS and the MERS infections in the past. What have we learned from that? What did we see? First, they reported a lot of anxiety with the patients, with the general population. I mean, depressive symptoms, irritability, insomnia, the concentration is less, performance is less, people don't want to go to work, their fear to be in contact with other people. Also, people feel stigmatized in their neighborhood, have fear to be rejected. They reported post-traumatic stress symptoms, and also alcohol abuse and dependence was reported in those pandemic. Then what kind of psychological reactions have we seen? As specific and uncontrolled fears related to the infection. I think a lot of people recognize these fears. Pervasive anxiety, a lot of anxiety, frustration, boredom, and loneliness. Loneliness, a lot of reported in the studies. There are some risk factors. There are some risk factors that can cause more psychological and psychosocial problems. For example, alexithymia, when people have difficulty expressing their emotions. Patients with psoriasis, for example, have more of this kind of problems. When there are inadequate supplies, how to cope with kind of problems is a risk factor. Inadequate information, all these kind of factors can cause more psychological problems. We also have protective factors. Resilience, the more resilience the patient is, the better they can cope with this kind of problems. The more social support there is, the better they can cope with this kind of problems. And if there have been had preventive strategies how to cope with problems, it's also a protective factor. This is important. If we want to do in the future something for our patients, we have to focus on this kind of factors. You have a brief overview. We can see the loneliness, the fear, the anxiety, and the boredom. All those kind of factors result in the well-being, the decrease of the well-being. The decrease of the well-being can lead to psychiatric conditions like depression, anxiety, and the less supplies we have, the less information we have. If there's more alexithymia, the bigger the chance we will get this kind of psychiatric problems. On the other hand, the more resilience we have and the more social support we have or get, the better we can cope with this kind of problems, and the bigger the chances the well-being will be better. So this is all in general population. And now we go to skin diseases. What do we know about the psychological distress associated with skin diseases? I think this slide is not new for anyone. We all know a lot of patients, 20 to 30% of the patients with skin conditions do have an increased risk of long-term psychological problems. We know this. We know there's a strong association with anxiety and depressive symptoms in patients with chronic skin diseases. We know bigger chance of social isolation. We know the stigmatization problem. And we also know that people with chronic skin diseases like psoriasis or eczema report suicidal thoughts. Conclusion, our patients, dermatology patients are vulnerable, are at high risk. And in combination with the COVID, we have more high risk, so we do have to be alert. Well, this is an article from July, specifically on for dermatology. And here's a nice overview what COVID can do cause with chronic skin disease patients. We know higher risk chronic skin disease patients do have a higher risk for mental disease. In combination with COVID, it can get higher. People with chronic skin disease isolate themselves. Isolation decreases the mood, increases anxiety, and increases social isolation. All those factors can give psychological problems. The chronic skin patients do have a reduced physical attendance at the medical services. The GP is closed, hospital is closed, or people don't dare to go to the hospital because of the fear getting infected. And if they don't go to the doctor, the skin disease can increase. Also, changes in the immunosuppression can give flares of, for example, psoriasis, eczema, and all those kind of problems can increase the anxiety and can decrease the mood. So you can have a vicious circle and it gets worse and worse. So this is not the situation we want. We want to prevent this. Well, is it all negative? Are there some positive effects on COVID? That's difficult. We in Holland, some patients reported with vitiligo that they're more comfortable now. They don't have to go to work. They're not different from the rest of the population. So that gives a positive feeling. This is not published, but it's my experience here in Holland. But on the other hand, they are reluctant to have camouflage again when they go to work again. And when it's over Corona, they do have to explain again about the skin conditions to colleagues. So the whole history starts again. So on the short term, there are some probably positive effects, but on the long term, they will have to face all the problems again. This is important. We can talk a lot about it, but what can we do about it? In the first article about the COVID and the general populations, I think this is very important. Implementing community-based strategies to support the resilience, the positive protective factors to vulnerable patients during the COVID-19. This is very fundamental. I think here we must focus on this. Well, how can we do that? I think patient organizations, scientific committees have to work together. And for example, we can provide information about basic well-being, about self-care advice. We can give advice about a good balance between work, personal time. It's mentioned in the article. Also things that, about daily structure, good sleep. In skin patients, very important, as no sleep can exacerbate the skin disease. And also providing extra information to look after their physical health in times they can't go to the hospital or their GP. Furthermore, if all those things do not help, what we also can give adequate and clear information about what steps to take and who to contact if they need medical help for the skin and mental health and for the well-being. Where should they go to? We can provide the information so patient can look it up and see where they must go to. And in case of psychological decompensation, where can the patient go to? So the conclusion is that the COVID crisis can have a big impact in the general population, but especially also in skin patients, as they're more vulnerable, and implementing community-based strategies to support the resilience and psychological vulnerable patients during the COVID-19 crisis is fundamental. And working together with scientific organizations and the patient organizations can provide good tools to help our chronic skin patients. And I think this medium is perfect so we can discuss. I think a lot of people have their own idea how we can provide tools for our chronic skin patients. That was my presentation. I give the word back to the moderator.